Do we need strong hips? Absolutely. A commonly prescribed exercise for strengthening the glutes, the muscles here in the buttocks, is called a hip lift or a glute bridge. There are a few factors that I'd like to address which I commonly see not being performed correctly. First of all, I like to use a band when I do the hip lifts because when the band is used, it helps you to engage and activate the gluteus medius muscle, the muscles that are on the outside of the hips, that externally rotate the leg. They rotate the leg out and abduct the hip, take the leg to the side. That kind of an action. The gluteus maximus, which would be the bigger one at the back, is mostly for extension of the hip, which means the leg, when the leg goes behind the body. This muscle helps that action. Okay, so the band I just like to put around the knees, and again that will help you to engage the gluteus medius, the piriformis, and the TFL muscles. And the band should be such that it's just enough tension so that you shouldn't feel like you have to pull really hard, not at all. First of all, the feet, they should be angled the same direction as the hips. Sometimes people let the feet splay out to the sides, so that will cause the ankles to pronate. So toes are pointing direction as the hips. And the toes should be spread and pushed into the floor, with also the heels pressed into the floor. Be careful to sometimes the feet will kind of shift around a bit, the outside of the foot, the inside, no. The toes are pressing and heel is pressing, pulling out slightly on the band. Now, the action is simply to engage your glutes and lift the hips up. Now, quite often when people perform this, their hamstring muscles cramp. And that indicates that the glutes are not engaging well. So first parameter, engage your glutes, squeeze the glutes together, lift the hips up, and then release. Okay, next thing, often people have the feet too far away. So as they're lifting, they actually drive off the quads, and which we do with most of our activities in life, so we need to focus more on the glutes. The feet should be back towards the hips so that when you lift, the knees are directly over the heels. Okay, now the core support. Another area that often people they let their back hyperextend like this. So as they lift, the back will arch, and that's simply that the glutes are not engaged well enough, the hips are not able to extend properly, so instead we arch the back. And that corresponds to our standing position, which would lead to lower back discomfort and often knee issues. So rather, engage the ribs, keep the ribs pulling down into the body with the core engaged, and then hips engage, hips lift. Now on the way down, keep the core activated, keep the ribs pulled into the body as you lower. Another area was when people start coming down, often they start kind of collapsing the structure, not at all. Should be stable all the way up and down. Okay, I invite you to join me for a few reps. Heels are close enough to your butt. You can do this in a bed. Floor is better, absolutely, you need a solid surface. Toes are pressed, heels are pressed. Squeeze your glutes together. Keep the ribs pulling down into the body and lift the hips. Keep the glutes activated on the way down, and then release. I like to do this as a hold, 30 seconds, 1 minute, holding at the top. And then follow that with repetitions, maybe 20 repetitions up and down. So thank you very much. I'm Uttara, and please join me on my YouTube channel, similar videos discussing particular exercises that are very beneficial. And please join our Zoom classes. The link to the Zoom classes is also on our YouTube channel. Thank you so much. Have a great day. Enjoy your fun.